All right, welcome back to ABA exam review and the continuation of our BCBA exam series. This is exam number 7, and we're continuing with the next set of questions. If you're new to the channel, welcome. If you're returning, welcome back. Please subscribe for all of our updates. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. The link is in the comments below. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. A child is experiencing night terrors that are waking her up during the night. There appears to be no pattern of night terrors nor any significant event that lead to the night terrors occurring, and mostly the terror seems random. A behavior analyst will reject the explanation based on what assumption? So, as behavior analysts, we have several assumptions that we must follow. Now, don't get the assumptions confused with the dimensions, right? And it's very easy to do when you're initially starting. You always want to separate our assumptions and dimensions. Here, we are talking about assumptions. Now, why would this behavior analyst reject the explanation? What possible reason could the analyst give to reject this idea? What do we know so far? We know the child is experiencing night terrors that are waking her up, but there appears to be no pattern of night terrors, no events that lead to night terrors, and the terrors seem random. As a behavior analyst, the idea that behavior is just random, that there is no pattern, that there are no events that lead to these events, or in this case, these night terrors, is just not factual to us. It is the opposite of what we believe. Because in behavior analysis and as behavior analyst, we believe behavior happens for a reason. Behavior is a response to the environment responds back, and that's how behavior occurs and continues to occur. And so, if you were a behavior analyst and you were told that this child is having night terrors, but there are no events or patterns, this just happens randomly for no reason, why would you reject that? What explanation could you give? A, empiricism. Empiricism says we have observed the events occurring. Now, nothing in this statement or in this question shows us actually observing the night terrors or observing events. We haven't actually observed the events ourselves or observed any significant antecedents or consequences or the result of any intervention. And so we're not being empirical yet. We're just simply saying there's no way these night terrors aren't caused by at least something in the environment. And so we might reject this explanation based on determinism. Determinism says the world is a lawful and orderly place, and behavior happens for a reason. We would never say these night terrors happen for no reason, they're random, there is nothing that leads to them. We would say that is not a deterministic outlook on why night terrors are occurring. Selectionism would have to do with the genetic or learning history of the child. Now, after careful analysis of the environment, we might start to bring into play the learning history. But based on this information, you wouldn't outright reject this idea on selectionism because maybe night terrors are genetic, right? Maybe they have to do with the genetic makeup of the child. We aren't sure yet. So we wouldn't say selectionism. We would still say, however, the night terrors are determined. We would take a deterministic view of the night terrors occurring. And then analytic. You should rule out analytic immediately. Why? Well, because analytic is one of our dimensions. It isn't an assumption. So again, be very careful about not mixing up our assumptions and our dimensions. In this case, why would you reject this explanation? Well, you would reject this explanation based on the assumption of determinism. A golfer wants to improve their ability to hit the ball off the tee. The golfer has been working with the coach for several weeks now and has seen significant improvement. The golfer enters their first tournament since beginning training, and the wind is blowing 30 miles an hour, causing the ball to fly all over the place. The wind relative to the impact of the coaching might be considered a blank if the wind was not part of the coaching. We have a longer question here, and we're not afraid of long questions. We just need to pay extra attention and understand what the question is asking, which is what we're doing in the first place. The question wants to know about the wind relative to the impact of coaching if the wind was not part of the coaching. In other words, we're looking at this wind and how it's affecting our results. And what are our results? Well, we have a golfer who wants to improve their ability to hit the ball, and the golfer's been working with the coach and has seen improvement. And so if we look at the coaching as the independent variable and the golfer's skill or ability as the dependent variable, there seems to be some sort of functional relationship. Now, when the golfer goes to the tournament and the wind is blowing 30 miles an hour, the ball is now flying all over the place. The wind was never part of the coaching. The wind is not supposed to be part of the intervention, and yet it's going to affect the golfer's ability to hit the ball off the tee, and it's going to affect our independent variable, or our dependent variable, I should say, data, right? So again, our dependent variable is the golfer's skill. The independent variable is the training. And now we have this wind that is now affecting our results. So what might we consider the wind? A, the independent variable. Well, the independent variable is what we're manipulating. And in this case, we are manipulating, or the situation is manipulating, the coaching and the training. This is controlled, and the independent variable is controlled by the researcher or the person involved in the intervention. The dependent variable is going to be typically our behavior. And in this case, the dependent variable is the golfer's ability to hit the ball. And so the dependent variable is influenced by the coaching. And then we have this wind, which was not part of the coaching. It is not controlled for, and it's affecting our results. That makes the wind a confounding variable. When we talk about confounds, we're talking about extraneous variables that are affecting our intervention. And that's a problem. We want to control for confounds as much as possible. And then a planned variable. Well, the wind was not planned for because we did not control the wind. What happened was we introduced the coaching. It led to an improvement in the golfer's skill. And then all of a sudden, this extraneous variable, the wind, came and started affecting how the ball was flying, affecting our results. That makes the wind a confounding variable. A behavior analyst wants to use a changing criterion design in a research project. Which of the following answer choices would be most appropriate to use in a changing criterion design? Changing criterion designs are one of our experimental designs in ABA. They're one of the least used, if not the least used designs, because they have some pretty strict limitations, right? And one of the key limitations to changing criterion designs is we're not necessarily looking at the effect of an independent variable on a dependent variable as much as we're looking at the effect of taking a known skill and trying to reduce it or increase it using a relatively increasing or decreasing criterion. And so in that case, when we're looking at a changing criterion design, we have to first look at behaviors that are known. Changing criterion design is not a teaching design, is what I'm trying to say, right? We've already got a known behavior that we're just trying to increase or decrease. In other words, I'm not going to use a changing criterion design to teach you how to spell. I might use a changing criterion design to teach you to spell more words correctly, but I'm not going to teach the skill. The skill should be known. And so if we want to use a changing criterion design in a research project, which answer choice is going to be most appropriate to use? A, evaluating the impact of a reading intervention on words per minute. Okay, if we're trying to look at the intervention on words per minute, that's going to be challenging. Why? Well, we're setting a criterion. In a changing criterion, you are setting a criterion that you want the behavior to hit. So if our words per minute starts here, let's say at 2, and then we move it to here at 6, we want the behavior to be all around the set criterion. What if that intervention is super effective? Well, it might blow past a criterion. So A is not going to be a great intervention or design to look at using the changing criterion design. It doesn't fit great based on our setup. B, teaching a learner how to answer unknown addition math problems. That's a problem as well, because as we talked about, we don't want unknown behaviors. We want known behaviors. We want something that is already in the client or the person's repertoire. C, decreasing the frequency at which an adult drinks coffee during a day. Perfect, right? Now, why would this fit? Well, let's say we have another changing criterion design, and the starting is they drink 4 cups of coffee a day. Well, now we want to change it to 3 and then 1. This is the changing criterion. Now we can look at, all right, if we set this criterion and reinforce for hitting this certain criterion, can we start changing or decreasing this behavior in their repertoire? And so that's what makes changing criterion a little difficult. The restrictions and what can be used is a little smaller or a little more restricted compared to our other designs. In this case, the most appropriate choice to use in a changing criterion design would be to decrease the frequency at which an adult drinks coffee during a day. Dr. Gina is reviewing standards with her class regarding how to graph data appropriately. Dr. Gina asks, now, what standard of the 4 are we talking about with this data point? And then motions towards the second standard. Motioning towards the second standard could be considered what? Okay, so pretty easy question, especially compared to the first 3 questions. And when you get an easy question on the exam, let's not overthink it. Trust your preparation, answer it, and move on. In this case, it's a pretty simple prompting question. And we're looking at the motion towards the second standard. So we know Dr. Gina is reviewing standards on how to graph. And then Dr. Gina gives the SD. Now, what standard of the 4 are we talking about? And then the prompt, which is motioning towards the second standard. So you can visualize that and identify the prompt pretty easily. It isn't a physical prompt because Dr. Gina isn't physically prompting anything. It is a gestural prompt because Dr. Gina is gesturing towards the second standard. It's not a positional prompt because Dr. Gina isn't manipulating the stimulus. And it isn't a modeling prompt because Dr. Gina isn't modeling the correct response. She's simply motioning or gesturing towards the response that she wants the class to give. Very straightforward prompting question. When we get an easy question, do not overthink it. Trust your prep, answer it, and move on. Sydney just passed her board exam and is preparing to onboard her first client. She has the client sign a service agreement prior to providing any services and outlines the pricing at signing. 2 weeks later, after the assessment was done and the first session was complete, Sydney tells the client that they will need to pay a $30 copay per session. This was not included in the service agreement. Has Sydney done anything wrong? In the most recent version of our ethical code, of the BACB ethical code, they've added a lot more business specific items given the amount of ABA clinics and practices that are being open. One of those items says you need a service agreement signed and you need to be transparent with your pricing. You can't hide fees, extra cost. You've got to be transparent up front. Now, Sydney, what do we know? We know she had the client sign a service agreement, which is good, and outline the pricing, which is good. 2 weeks later, after the first session was complete, so she started services, she now tells the client they have to pay a $30 copay, which wasn't in the service agreement. Is that a problem? It is. Regardless of intent, regardless if Sydney forgot or was new or she didn't know, it has to be signed on and agreed upon before she can make them pay this copay. It's got to be transparent. So has Sydney done anything wrong? A, yes, you must include all fees and costs up front to the client. A is absolutely true. Read all of your answer choices. B, yes, you cannot charge copays for services. Copay is part of the deal for many insurance-backed providers. It's just part of the service agreement. Copays are not unusual. C, no, the client signed the service agreement. They did, but they were not told about the copay, and now they're asked to pay the copay. That's an issue. D, no, Sydney went over the pricing at signing. She did. She didn't cover the copay. Again, with ethics, intent doesn't matter as much as what was actually done. And that's what can make ethics tricky, right? Regardless of Sydney's intent, $30 copays are not agreed upon. They weren't discussed. Before Sydney can tell the client about this copay, either she needs a new service agreement or something else needs to be done where there's signed and agreed upon payments for services. So, has Sydney done anything wrong? Yes, you must include all fees and a cost upfront to the client. Thank you for watching. Please subscribe for all of our updates. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.